So a 20-year-old female comes to the clinic due to getting nauseous when being in cars. When she's in a car, she'll start feeling nauseous and will have the urge to vomit accompanied by a spinning sensation. What is the mechanism of action that helps alleviate these symptoms? Dopamine 2 antagonism, serotonin 5-HT3 antagonism, histamine H2 parietal cell antagonism, or histamine 1 inverse agonism. I'll let you answer the question and then I'll explain. Okay, so the answer is going to be D, histamine 1 inverse agonism. So for this question, it's going to be inverse agonism, and overall the actual problem is going to be motion sickness. But let's talk about inverse agonism first. So essentially what happens is if you have a normal ligand, so for example, histamine, come in and then bind to the receptor, it's going to have an effect, right? So let's say that's true. And so the second one is this drug, right? And it binds to the same receptor in the same way the first one does, but it creates the opposite effect. And so that's going to be false, right? So it's a completely different effect. So to put into more concrete terms, if you have the ligand bind to the receptor, let's say you have muscle contraction, and then over here, you have a drug that binds to the same receptor as this one. However, it creates relaxation on this one. Then it would be called inverse agonism. And so in this case, this is what Benadryl does for people that have the motion sickness. And so describing motion sickness a little bit more. So it's typically accompanied by nausea and vertigo. And so that's why in the question stem, the patient obviously had nausea when they were in the car, and they also had the spinning sensation, which is the vertigo-like symptoms. And so typically this usually occurs on cars, buses, and when you're at sea on a boat. So anytime you have, if you're a passenger, you're going to experience this type of problem for these specific types of patients. And so motion itself, how it's detected and processed in the brain is multi-system. So the first one is going to be visual. So your visual system, so your eyes are going to pick up where different objects are in the environment. The next thing is going to be proprioception, which is just your brain knowing exactly where your hand is at all times. So for example, if you close your eyes, you know that your hand is in front of you or behind you, and that's proprioception. And so the final one is vestibular system. So for this system, essentially when you close your eyes and you're trying to balance, this is what's helping you balance, and it's processed through the ossicles in your the otoliths in your ear, in your vestibular system. So these otoliths are little stones in your ear that when they move around, they actually send signals to your brain, and they help also orient you to acceleration, deceleration, and also to relative motion. And so in this case, motion is determined by all of these, and for some people, you can have dysfunction of that. And that's where motion sickness comes in. And some ways to alleviate this is by using your other senses. So for example, if someone with motion sickness tries to focus on an object, their visual input can actually help alleviate the symptoms that they're otherwise having, such as the vertigo. But in typically pharmacological treatments are better at preventing vertigo and preventing motion sickness rather than just taking it while you're having it. So you try to typically want to prevent it from happening in the first place, and not use it while you're actively having the motion sickness because it won't be as efficacious. So moving on to the other answer choices. So we have dopamine 2 antagonism. And so for this one, we have metoclopramide as the example, otherwise known as Reglan. So typically you use this as an antiemetic, which just means you prevent vomiting, but you wouldn't use it in this case because that's not the issue. Even though she is feeling nauseous, you're not solving the root problem. And so this wouldn't really help. And so something the boards like to test you on for something like Reglan is tardive dyskinesia, which is a movement disorder problem. For example, it can be lip smacking, it can be foot tapping, so just these small repetitive movements, because if you remember, dopamine is involved with motion. Typically, people associated with the pleasure hormone, but in reality, it's also associated with motion. And so if you have antagonism of the receptors, eventually what's going to happen is you're actually going to get a increase in those receptors because you're starving them of their ligand. And so if you stop it, or eventually what will happen is you become hypersensitive to dopamine and you end up with these different movement disorders. And so the other answer choice is serotonin 5-HT3 antagonist. So in this case, it would be Zofran or a Dancitron. So once again, this is just to treat vomiting and nausea, but in this case, the underlying issue is motion sickness. So that also would not be the answer. And then finally, you have histamine 2 antagonism. So this is going to act on the parietal cells of the stomach. And so this is used more for GERD, so gastroesophageal reflux disease, and it's used to decrease the gastric acid by stopping histamine from binding to the parietal cells so that protons cannot be pumped into the lumen of the stomach. And so once again, this is used for GERD, and so it wouldn't be relevant to this question. So just to summarize, this question is talking about a patient with motion sickness. So you just have to realize the pattern recognition of the symptoms of vertigo and also getting nauseous, especially in these specific situations, such as being in a car or a boat. And so it's motion sickness, and then knowing the treatment, which is going to be something like Benadryl, and knowing the mechanism of action of Benadryl, which is going to be histamine 1 inverse agonism. So I hope that helped, and thanks for watching.